Hi, I'm Lisa DiBrigida, and I am the Associate Director of Medicine Pediatrics here at Amoskeag Health. I wanted to come on and just sort of give you guys a little bit of information about vaccinating for this crazy COVID time. So as you all know, we are now able, between the ages of 12 and 21, to get the vaccine for kids. And I have to say, I highly recommend that you do that you get this vaccine for your children. And if you are one of the teens, please think about getting this vaccine. The one that's available right now that is approved is the Pfizer vaccine. That is an mRNA vaccine. And I know there's some confusion about people's concerns about that. mRNA is simply the mechanism, the way our bodies make protein. And there's a whole lot of things inside our body where we have mRNA that works that way now. It makes insulin, it makes all of our hormones that actually help our body grow and everything else. So this one works by the mRNA is injected into our bodies and it promotes the spike protein that identifies COVID. It is not COVID. It just simply looks like the COVID vaccine. So what happens is our body then develops the immunity to it. So it works in this wonderful way so that if the virus then gets exposed to us, we will be able to fight it because our immune system has already figured that out. Once it has done its job and our body has developed that immunity, it's gone. That mRNA is gone, and it's not a problem. It cannot affect fertility. It cannot affect the growth. It cannot affect a child's brain. There is absolutely no way that any of that can biologically happen. So it's in that sense, I can be very reassuring to all of you that there's nothing to worry about from that standpoint. Now, do we know long term? I mean, in fairness, we really have only been doing these studies for about 6 months, but the mechanism and the science behind the mRNA has been around for 15 to 20 years. It just hasn't been used in humans, and so we're getting all of that information, and I completely appreciate people's angst about it. But when you look at other vaccines that we have out there, for example, the flu vaccine that many people are doing and we have been doing for many years, we still now have about 100 children a year in the United States of America that will die because they didn't get their flu vaccine, okay? From chickenpox, we have about 50 to 75 each year who will die because they were not vaccinated and get chickenpox and can have complications. For COVID this past year, we had over 300 children who died. So it is worth getting the vaccine because you do not know if your child is going to be one of those 300. We simply don't have that information. So it's very worth it. I definitely would be doing my own children. My children are now young adults and they actually are both vaccinated. The other thing I wanted to mention is side effects. The side effects are the same as what has happened for us adults. Although the kiddos, because their immune systems are stronger and more vigorous, can sometimes have a higher chance of having body aches and fever, any of those things that occur in about 2 to 3 days after the vaccine. And of course, some soreness at the site. Otherwise, kids are doing really great, and I think this is going to allow us to go back to some semblance of normal in the fall. We're hoping, actually, that Moderna and Johnson & Johnson are also going to be approved for this age group sometime soon. They're doing their studies right now, and they will be applying for the emergency permission as well. And we're hoping that the age group will go down to about 5. So it'll be 5 and up by the fall is what we're hoping. So there's a lot of information. Please ask your provider if you have further questions. We're here, we're available for you, but please get vaccinated.